Hello, everyone, and welcome back to another Facebook Live with myself. My name is Sam. I'm the sport and performance expert here at Sheffield Sports Medicine. And today is a brand new topic, a brand new month, and we're looking at ultrasound. So, if you've seen from the title, we're looking at how does ultrasound diagnose sports injuries? Okay, and it's a great question, and a question that I'm sure a lot of you would like to know. But before we go into that, let's discuss what an ultrasound scan is. Okay, so it's basically something called an ultrasound scan, or also known as a sonogram, and it produces high frequency sound waves to create an image. And it's very good at looking at structures in terms of bones, ligaments, muscles, cartilage. All right, and it's often used especially for women who are pregnant to look at babies. All right, but it's a very good tool used to have a look at imaging and see what's going on under the superficial layer of skin. Okay, and as an injury clinic here, we use it quite often to diagnose certain injuries or look at structures that may have been impacted in some way or which way. So in terms of looking at structures, you can use ultrasound to find problems with muscle, so muscle tear, okay? And the ultrasound will show if it's torn, if it's bleeding, how bad the tear is, if it's gone completely like a full rupture, all right? So ultrasound is very good at diagnosing muscle tears and ruptures and things of that nature. Okay, but it's also great at looking at tendons. All right, so when people have got tendinopathy, tendonitis, usually, you can usually say, oh yeah, this is tendonitis, this is a tendinopathy. But by ultrasounding it, you'll be able to give yourself 100% clarification doing that, because when you're scanning that tendon, you'll be able to see how big it is, if it's larger than usual, if it has a lot of inflammation, if it's a lot of bleeding, and just a lot of any damage there, or if it's still there. Because don't get me wrong, some people, you rupture your tendon, and we're trying to find it, and we realise that it's not there. Okay, in which case it would be a rupture. But ultrasound can also be used to have a look at bones, especially superficial bones. So, like for example, hands, feet, you can usually look at bones there. But if it's a bit deeper, it can be a little bit harder, in which case, obviously, you need to do more of an MRI, X-ray kind of scan. But yes, certain areas of the body you can definitely see bone. So you will be able to see breaks, etc., especially in the hands. Cartilage, we'll also be able to see cartilage in the knee, fingers, hands, ankles, elbows, things like that are quite superficial, not too deep. But obviously, the deeper you go, the harder it is to get that image. So when we're looking at ultrasounding, if it's superficial, it's quite easy to find, then yes, we can easily scan that and get an ultrasound picture of what's going on. And the best thing about ultrasound is it's just that it's almost the gold standard, because you have an image, you can see clearly what is going on, and from that you can diagnose injury and give the right treatment from there on. So that's how we use an ultrasound to diagnose sports injuries, and well, not just sports injuries, but obviously chronic injuries as well. Tendonitis, tendinopathies, things that have been going on for a long period of time. You can also use ultrasound to diagnose that, and that's why it's such an important tool and such a great tool for diagnosing and looking at the problem. Because ultimately, don't get me wrong, it's really important to see what's going on, but it's just as important to be able to treat that and treat the cause. Because sometimes with these chronic issues, such as overload issues, tendonitis, tendinopathies, yes, ultrasound can see it, but that will not treat it. Okay, that will just diagnose it. Therefore, we still have to find the problem, the cause of what's going on, and fix that using other methods. Okay, but at the end of the day, ultrasound's great for actually looking at structures, finding issues with them. If that could be anything from muscles, tendons, bones, cartilage, and actually finding out what's wrong structurally, so we have a better diagnosis and better plan of getting people out of pain and helping them get back to their best again. So that's pretty much it in terms of how does an ultrasound diagnose sports injuries, and also how does it diagnose chronic injuries as well. So just for a takeaway today, just remember that an ultrasound is basically a procedure that uses high frequency sound waves to create an image of part of the body. And yes, it is the same thing they use for women who are pregnant, but also it's widely and often used for looking at other structures as well, like the ones we've just spoken about today. So if you or you know anyone who is struggling with something and they think they might have a structural issue, then ultrasound could be a great way to actually find out, because at the end of the day, when you do the ultrasound, you're either going to find something or you're not. Okay, in which case, if it's structural, you'll find something. If it's not, then you have to ask yourself, what's going on there? Why are we getting pain? Okay, so that's pretty much in a nutshell of ultrasound scan and what we use it for, how to diagnose things using that scan. I'm sure we'll be going into a bit more detail as the weeks progress, but this is just introduction to ultrasound scan for today's Facebook Live. So I hope you have found this interesting. And I now hope that you have learned something in terms of ultrasound scan and diagnosing sports injuries, what we look for, what we use it for. But ultimately, it's a fantastic tool. And if you are ever in doubt of a structural issue, then yeah, it would be a good way to get a scan. But remember, if you're going to get a scan, it's going to have to be more superficial. For example, it's not going to be able to look too deep and find things that are really deep in the body. But anything superficial, you'll be able to see. You're looking at your tendons, your Achilles, elbows here, hands, wrists, knees. It will be absolutely fine for that. And to be honest, most of the time, that's what we use it for anyway, looking at tendons, Achilles, and knees as well. So I just want to say a big thank you to all of you who have watched me today, and thank you for listening. I'm sure there will be a lot more in-depth talk on ultrasound scan as this month progresses. So please do look out for that, and we do look forward to helping you guys and speaking to you more about ultrasound scan in the future. So thank you again for listening, and have a great day, great weekend. Take care. I will see you all next week. Bye bye.